Good day everyone, this is Anwar S. Taga Jr. So I'll be performing assessing Glasgow Comascale. So what does it mean? Glasgow Comascale was originally developed to predict recovery from a head injury. However, it is used many professionals to assess level of consciousness or LOC. It tests in three major areas. First one, we have this eye. The second one, we have this response and verbal response and monitor response. After that, an assessment totaling of 15 points indicated a client is alert, which is completely oriented. A common told client scores of 7 or less. The lowest total score is 3 out of 15. So now, let's talk about the purpose of this. First one is, it is an assessment used to assess and calculate the patient's level of consciousness. Second one, it is used to objectively describe the extent of impaired consciousness in all types of acute medical and trauma patients. So, the equipment that we're going to use is that pen or pencil. So now, the first procedure, identify patient correctly and explain the procedure to the patient to avoid medical errors and for medical errors and ease and confidence. Okay, so you are Mr. Dr. Ramos. Next one, perform hand hygiene to observe proper infection control. So assuming that they've already performed hand hygiene, so next one, assess best eye opening response. Observe eye opening before stimulus to assess eye response. Okay, call patient's name in eyes are not opening spontaneously. If, however, the patient is not opening their eyes spontaneously, you need to work through the following steps until a response is obtained. Mr. Dr. Ramos. Okay, next step. If no, apply pressure in the knee bed by using a pencil to squeeze the strep muscle or apply pressure on the supraorbital notch. This is also a good way to assess the patient by responding to the pain. Next one, we have record patient score for best eye response. Spontaneous 4, to sound 4, 3, to pressure 2, to response. To assess eye response, initially observe if the patient is opening their eyes spontaneously. If then, your assessment of this behavior is complete with the patient scoring 4 points. Okay. Next one. If eyes are closed due to swelling, write C or NT if non-testable due to other factors. If some local physical factors precludes the patient being able to make response, that component of the scale is not testable. Best verbal response. Okay, next one. Ask patient name, place, and date. Assessing patient verbal response initially involves trying to engage the patient in observation and assess if they are oriented. Okay, sir, what is your name? Can you tell me your name? Okay, then your place. And then, place. The next one, record patient score. Alert and oriented. 5, confused. 4, inappropriate words. 3, then incomprehensible. 2, then no response is 1. You should score the patient based on the highest scoring response they demonstrated during the assessment. Next one, we have if verbal response non-testable due to factors interfering with communications, write NT. If the patient is intubated or has other factors in interfering with their ability to communicate verbally, the response cannot be tested. And for this, you would write NT, not testable. Okay, next one. Best motor response. Ask patient to wiggle toes or move raised arms. Verbal consent must be gained from the patient. Okay, sir, can you move it? Tips. Okay. Thank you so much. Next one, if no response, apply firm and gently pressure on nail bed by using a pencil or pen, or trapezius muscle squeeze, or on the supraorbital notch. The different ways of assessment. Okay, the rationale of this is that there are different ways of assessing the response to pain. Score, follow direction to month 6. Localized pain is 5. Withdrawals from pain is 4. Decorticate posturing is 3. Decerebrate posturing is 2. So no response is 1. The rationale of that is you should score the patient based on the highest scoring response you were able to elicit in any single lead. Okay, for the next one, if the best motor response is non-testable due to paralysis or other limiting factor, write NT. If the patient is unable to provide motor response, for example, paralysis, this should be documented as not testable. Next one, moving on. Add up the score for each category. Refer the score to the doctor to assess and calculate the patient's level of consciousness. The next one, place patient in a comfortable position to ensure comfort and safety of the patient. Next one, document time GCS was done in GCS score for documentation and future references. Thank you so much.